Hi everyone, this is Dr. Shushma Sarilla, consulting homeopath at Fidicus Homeopathy. Today we are going to discuss about a topic called as acne. This is something that anyone would have experienced in their lifetime, at least in their teenagers, either in the mild form or in a serious form. Why are we discussing acne today? It is not a life-threatening problem, but the reason we are discussing is because of the psychological impact it has on individuals. If you're going to an office, your first day at work, or if you're attending a marriage, or it's your own marriage, you would like to be presentable. It would impact your confidence and the way you present yourself to people. You would like to have an even skin tone which doesn't have scarring or pigmentation. So today we are going to discuss about this because it's a worldwide problem. According to the statistics, 84% of the population suffer from this. So we will go in depth on the acne topic. Let's dive in. So, what is acne? In the medical field, we don't call it as acne, we call it as acne vulgaris. So, what is the definition? Let me put it in a simple manner. It is nothing but there is improper drainage of the sebaceous gland which produces sebum and it comes up every day. So, this process is hampered because of excess production of sebum or because of hyperkeratinization. Keratin is a tissue which is produced in the dermis and is moved to the epidermis. Okay, so what are the signs and symptoms of acne? So whenever you feel or whenever you get the thought of acne or the word acne, whatever you feel is you have cysts or bumps. Not only that, but even whiteheads and blackheads are considered as signs and symptoms of acne. What is a whitehead? Whitehead is nothing but a closed or a clogged hair follicle which has a lot of dirt and excess sebum in it and it is closed. That is called as a whitehead. What is a blackhead? Blackhead is nothing but an open whitehead or an open hair follicle which is clogged. Here you can see this is a whitehead and this is a blackhead. Almost 94% of the population suffer from whitehead and blackheads on their skin, which hampers their look. And then getting into the next one, which is called as papule. What is a papule? Papule is nothing but a closed hair follicle or a clogged hair follicle which is inflamed, thus the reddish hue appearance. And what is a pustule? Pustule is nothing but a clogged hair follicle, but it has had gone through the inflammation and now is in the pus stage. That is why the yellow color appearance. Yeah. What is a nodule? Nodule and cysts are something which we should be worried of because they give a really bumpy appearance to the skin and they are very painful. How do you differentiate a nodule from a cyst? Nodule is something which is bumpy, which is a little firm or hard when you touch your skin and it is very painful. And then coming to the cystic is or cysts are something, they are softer than the nodules and their appearance is more reddish, and not only that, they are also painful. The only difference is that this nodule is a little harder and the cysts are a little softer. Cyst is always filled with pus. And not only that, this nodular or cystic acne is something which is related to the hormonal issue like PCOS. Now let's dive into the investigation part of acne. So first we'll start from the top down most one, that is hormonal analysis. So what is hormonal analysis and why do we need hormonal analysis for acne? The main reason is that a difference or an increased androgen level like your testosterone free and total, or your increased or decreased FSH and LH ratio, or increased prolactin, and differences between your estrogen and progesterone will hamper or will directly have an influence on the sebum production, and increased sebum production will cause a clogging in the hair follicle which will produce acne. And coming to the fasting glucose level, because of the fast pace of our lives, we are constantly under stress and we are eating a lot of food which is not good, and also irregular sleep cycle will lead to insulin resistance, which will also have a direct impact on the sebum production. Coming to the lipid profile, as we binge watch series on Netflix, as we eat a lot of chips, a lot of sugary foods, this will increase the bad cholesterol, LDL, and very low density lipoproteins and low density lipoproteins. These will cause increased sebum production and increased hyperkeratinization or increased keratin tissue, which will lead to clogging of the pores. And coming to a new one, I think this is something that you have not heard of, or it is rare. This is called as DHEAS, which is a hormone. This is dihydroxy epiandrosterone sulfate, which is released by the adrenal glands and in a smaller quantity by the ovaries and the testes. This will also have a direct impact on the sebum production and the clogging of your hair follicles. So these tests, see, investigations are not something which should be done on every type of acne. These tests should be done only when you have other related symptoms like your hormonal issue, like your PCOS, or if you are having anything like a tumor which secretes a lot of androgen, or we have acromegaly, or we have Cushing syndrome, we can get through the hormonal analysis. Or if you are having a very stressful life, investigations are something which are not to be performed from all on all kinds of acne. All kinds of acne need not have investigations, but the thing where you need acne investigation is when you have hormonal disruption, or you're currently suffering with PCOS, or you have had a history of PCOS, or you're having a history of stressful life, improper food, hydration and sleep cycle. Then these tests will come into action. Then coming into the basic structure and function of the skin. As you can see in this picture, this part is called the epidermis, which is the topmost part of our skin, and it has dead skin cells. It's a skin barrier, it's waterproof and protects your skin from the outermost environment. And then coming into the dermis, as you can see, the dermis constitutes the major part, which is divided into two parts, the papillary part and the reticular part. This has the rectus pilae muscle, which is reason why you have goosebumps. When this muscle contracts, you'll be having goosebumps. This is sebaceous gland. This is a reason for the sebum production. And then we have keratinocytes lining the hair follicle. So every day what happens is the sebaceous gland produce sebum, and the keratinocytes are moved from the down part to the up part or pushed to the epidermis every day. This is what happens in a healthy skin cycle. And then we are coming to the causes and risk factors, or what are the reasons for your acne. The main thing is your genetic. If your genetic makeup, either your mother or your father or your primary sibling is suffering from acne, you might also have a tendency to suffer. This is genetic. Hormonal, as I already discussed in the investigations, your difference in LH and FSH ratio, difference in estrogen and progesterone, or you have a high testosterone level or a high androgen level, you're more prone to have acne. Bacterial factors, usually we have bacteria since we are always exposed outside. We have bacteria on the skin which usually does not do anything. But we have, if we have added features like improper food consumption, improper water consumption, or improper sleep schedule, it will aid in this bacteria to proliferate when there are hormonal disruptions. And then we have improper food habits, as we all know, and high iodine content. Why is this a major cause? Is because when we binge watch series, we take in a lot of salted popcorn, or we take in a lot of chips. All these have high iodine, which will have a direct impact on the sebum production. Something which is very rare and no one discusses is a vitamin B6 and vitamin B12. Higher doses of vitamin B6 and vitamin B12, they will have a direct impact on the sebum production, and they will increase your skin dryness. So whenever you're taking supplements, make sure you're taking it in the recommended daily allowance. And then whey protein. Every day we see a lot of gym videos. Every person or the other person is posting about how protein powder is important when you're building muscle. But remember, if you're taking a lot of whey protein, and if you're taking branch chain amino acids which are present in the protein powder, they have a lot of protein with no or zero fat content. If this happens, they have a direct impact on an insulin like hormone called as IGF-1, which will have a direct impact on the skin and will cause acne. So next time if you see a gym freak suffering with acne, tell them about this. Then we are going to the comedogenic products. So these days we are seeing a lot of commercials on different kinds of skincare, but nobody knows what is good for their skin. So if you're using something which clogs your skin pores and which is oily, if you're having an oily skin and you're using something which is clogging your skin pores, then it will lead into acne. So next time you're buying a product, see that it is non-comedogenic. And then caffeine. Caffeine is the highest consumed product today because of the stressful life. We are consuming lots of caffeine. This has a lot of effect, and not only that, caffeine will dry out your skin and also cause hyperkeratinization. And then coming to alcohol, if you consume a lot of alcohol, you will see that your skin will tend to become dry and your sebum production will be more. And not only that, alcohol will aid in hyperkeratinization as well. Then coming to high trans fat consumption, which can also be included in your improper food habits. If you are consuming something which is not whole or natural, it will increase your lower density lipoproteins and very low density lipoproteins, which will increase your sebum production, leading into acne. Next, coming to the body changes or the pathological changes, let's view it in a deeper manner. As you can see, we have a hair shaft or a hair follicle, and surrounding it we have keratinocytes, and then we have sebum here, sebaceous gland here. So what happens on an everyday basis is that the sebaceous gland secretes sebum. This sebum along with the dead keratinocytes is moved upwards to the epidermis. What this sebum does is it builds the acid mantle, which helps in protecting our skin from the direct sun rays. Okay, what happens if there are any causes or the risk factors, as we have discussed before? What happens is that the sebum production is increased. As you can see, the sebum production is increased and the keratinocytes are clogged inside, leading to a clogged pore. If this happens on a regular basis, or if you're using something which is comedogenic, or if you're using something which is trapping all of these, or if you're having hormonal issues, if you can see, the sebum production is increased and the dead keratinocytes are clogged up here. So what happens next? What happens is that the bacteria which are usually present on the surface of the skin will get into the hair follicle and they will start proliferating or increasing. These bacteria will start increasing and then they will release something called as inflammatory mediators. This inflammatory mediators will call help for our white blood cells. When the white blood cells come in, a lot of pus is seen. So in this stage, you can see a whitehead or a blackhead, and if it furthermore increases, then you can see a pustule or a papule. And then if it breaks out, this sebum or the exudate from the white blood cells is taken out in the form of pus, that is called as a pustule. And even if that is continuing on a longer run, we can see the appearance of nodules, which are much more painful, and even we can see the appearance of cysts, which are also painful. I hope you have understood the bodily changes that are happening in the acne. Then coming to the types of acne. See, while you're viewing this video, if you're suffering from acne and you don't know what type of acne you're suffering from, when you're viewing this, you can understand what type of acne and what type of treatment you need to take. So let's dive into the types of acne. First one is called as hormonal acne. How do you see if it is a hormonal acne, or how do you identify if it is a hormonal acne? First thing, if it is a female, you will be having very irregular period or periods every 15 to 20 days. You will be having some sort of disruption in your menstrual cycle. As I've previously told you, hormonal acne is nothing but which is caused by disruption of your hormones, that is increase and decrease in your hormones. So how do you identify them? You will have nodular or cystic acne, that is painful acne, red bumpy skin, especially near the jawline, the chin area and the neck area. And you will also see extra growth of hair, which is called as hirsutism, if you have hormonal issues. This is nothing but hormonal acne. The second type of acne is fungal acne, which is a little rare. You will see fungal acne when you don't wash your face regularly, or if you're exercising, you sweat a lot and you don't wash your face after exercise, you stay with that sweat on your face, it can lead to fungal acne. So fungal acne is usually caused by yeast, and then proliferation of that yeast will cause fungal acne. How do you identify this fungal acne? You will have small bumps along this forehead area. This forehead area along with the upper zygomatic area or your upper chin area, you will be having fungal acne. They are not nodular or cystic, they are small tiny bumps, but the characteristic feature of this fungal acne is that they are very itchy. Then is acne mechanica. This is the second part of your exercise acne, wherein you sweat a lot. Like for example, you're wearing your bike helmet for a longer period of time. You're wearing your baseball cap or a baseball hat for a longer period of time. You're wearing straps for a longer period of time, or compressions, something with your t-shirt. You're wearing it for a longer period of time. You're sweating a lot, but you're not changing the clothes frequently, you're not changing your hat frequently, or you're not cleaning them properly, then you develop something called as acne mechanica. It's because you have a lot of sweat and irritation that happens near this area or the area which is having compressions. That area will start reacting and getting irritated, which leads into tiny small papules. So red color bumpy papules, a bumpy skin can be seen near especially the forehead area, and also if you wear compressions for a longer period of time, you can see it even here also near the forearm. And then acne cosmetica. This is more frequent and much regular in our clinic these days because people are using a lot of cosmetics. And if you have an irritation after applying a foundation or after applying some cosmetic product on your skin, if it is aggravated or caused, like for example, you're applying something and on the second day you start feeling bumpier, your skin feels not normal, then that is because of something called as acne cosmetica. These are small bumpy red color papules which appear on the skin wherever you have put the cosmetic product. It is not particular to a certain region on the face. Usual presentation would be on the cheeks area because you put a lot of blush, you put a lot of foundation and concealer on this area. This area will get irritated and then you will develop something called as acne cosmetica, which usually subsides after decrease in use of your cosmetics, or if it is proliferating into nodular, you will need treatment for it. Then this is called acne conglobata, which is the severe form of acne. In whom do you see this? You see this in people who are trying to build a lot of muscle and take steroids. They take testosterone and then this develops. This is nothing but acne conglobata, where you have severe cysts, as you can see, and nodular growth as well. And this cysts and nodules are connected internally, leading to a pus filled under dermis. Or you can see that if you palpate it or if you touch it, you can feel that the pus is moving and it is internally connected with each and every cyst on your face. It is severe form and it needs complete treatment to be cured, and also you have to stop your steroids or testosterone if you're taking it. Then the industrial acne, it is very rare kind of acne. If you're dealing with something which has hydrocarbons in it or coal tar in it, and then you start developing something like this on your forearm, then this is called industrial acne. As soon as you regress it from it, or as soon as you stop your exposure, this usually will subside. They are just a little itchy, not as itchy as fungal acne, little itchy, but you can see that there are small papules here and there. Usually it is not infectious. As soon as you stop your exposure, it will usually subside. Then acne rosacea. I think you all remember heroine Sai Pallavi. She suffers from acne rosacea. This is malar flush around your cheek area, usually genetic in nature, or if you're using a lot of cosmetics, or if you're having a lot of sun exposure, you will have this malar kind of rash. Along with rash, you will have a small bumps. You can see that it is red in color and it will have a lot of small bumpy papules on your skin, especially in this area. This is called as acne rosacea and it needs treatment. Now we'll be discussing about the conventional treatment methods. Usually whenever we suffer from acne, we usually visit a dermatologist, and what do they suggest? They suggest topical retinoids, which is good because they have retinoic acid, which is a vitamin A derivative. It helps in exfoliation as well. It gives you a good skin tone, even skin tone. But the thing that you need to remember, as we have discussed earlier, is that acne is not an external problem. Acne is something which is arising because there is some problem in your system. Either it can be glucose intolerance, hormonal, or genetic. So if you're treating it from the topmost part, or you're applying something topically, it will be very temporary. Next, what are the side effects of topical retinoids? It can cause redness and severe dryness. And also it cannot be used for a longer period of time, and it cannot be used for people who are very young. Like for example, it cannot be used on your teenagers. Then coming to benzoyl peroxidase, which is antimicrobial or antibacterial, as we can say. What are the bad benefits of benzoyl peroxidase? Are that it can cause contact dermatitis in some people. We have studies which show that benzoyl peroxidase can cause a little bit of darkness, dryness, skin irritation, and contact dermatitis. And then coming to antibiotics, if you are suffering from a bacterial infection in your acne, it is nodular, it is cystic. So next, coming to your antibiotics, if you are suffering from nodular or cystic acne, or acne which is not reducing at all, then you visit a dermatologist. She will give you antibiotics so that the p acnes bacteria does not increase in your or does not clog your pores, and the proliferation is decreased. But what are the side effects about antibiotics? If you have some health issue, if you are feeling unwell, you use antibiotics. If you're having stomach problem, you're using antibiotics. We are using antibiotics as if they are some sort of vitamins. Using a lot of antibiotics will have a bad effect on your gut microbes, which are very essential for a healthy living. And not only that, a use of lot of antibiotics will cause resistance as well on a longer run. And then the oral retinoids, which are like the main culprit here, because if you're using oral retinoids and by mistake you've become pregnant, they are teratogenic. That means they will cause malformations. Even if you're taking one pill without notice, they can cause severe malformations in the fetus. The studies have been established, even the statistics have established that if you're pregnant and you don't know and you've taken an oral retinoid, or if you're planning to become pregnant, or if you're married, oral retinoids are something that you should avoid. So if you're suffering from acne and you're taking something which is temporary, something which is killing your own good bacteria, something which is killing your own fetus, why would you want to opt for a conventional treatment? Why not homeopathy? Now we are dealing with homeopathic treatment. See, for example, you're applying a retinol cream. It will stay there or treat your skin for a period of, let's say, 6 months. After that, what would you do? If you're taking antibiotics, how long would you like to take antibiotics? Let us treat something which is going to work from inside out, something which is sustainable, something which is permanent, something which is holistic, and something which is tailor made. That is something for you, something for each one of us suffering from acne. So while you're dealing with homeopathic treatment, we deal it holistically, and we deal it from person to person. Each drug or the each medicine will differ, because one person is different from the other, and one stress is different from the other. So if you're suffering from PCOS, if suffering from PCOD, if you're suffering from something called genetic acne or hormonal issues, we can treat it in a better manner without side effects, holistically improving your overall health, not destroying your gut microbiome, and increasing your lifespan with good years or healthier years, we can say it that way. So try opting for homeopathic treatment which does not have side effects, something which is custom made. We are investing lakhs in a custom made lehenga. Invest a little bit more on your health and invest in homeopathy, which is cost effective as well as holistic and just fit for you. Then next, go to the precautions. Even if you're treating with homeopathy, you need certain precautions so that you don't get your acne back. So that is, if you're applying makeup, try cleansing it. Even if you are taking homeopathy, you need some precautions so that you don't have an issue of acne again recurring. So what are the precautions that you need? The main precaution is keeping your skin healthy and clean, not trying different products every month or so. Even if you're seeing a commercial, even if you feel that your skin is going to look like the person in the ad, you might be wrong. Just know your skin, try to understand it. Apply makeup and then remove it regularly when you're going back to sleep. And then apply creams which are non-comedogenic in nature. Drink water regularly by sip method. Don't drink water, gallons and gallons of water, just because some person has told you that a lot of water will help your skin. No, try drinking water in the sip method. Sip method will help water reach the cells and will give you that glow that you've always wanted. Drinking a lot of water at a stretch might not be helpful. It is just flushed out through urine. So then try including cucumber or lemon or orange in your water when you're drinking, like a detox therapy. Try including lemon, orange, or mint in your water while you're drinking so that it helps you keep hydrated, giving you that needed and essential minerals. And then try not touching your face frequently, because touching your face frequently, you might have a lot of bacteria on your hands rather more on your face. Like the proportion is a little bit more on your hands. So try not touching your face frequently. Do not pop your pimples, that will lead to scarring and pigmentation, and then it will take a lot of time to cure it. And then avoid coffee or alcohol on a regular basis. Even if you are taking caffeine on a regular basis, try to decrease the quantity of the caffeine. And then include a lot of vegetables in your diet, include protein rather than a protein powder. Try taking chicken, try taking tofu, paneer, all the protein sources. And then in a natural form, I would say try taking whole foods. Try consuming chapatis instead of consuming biscuits or something which is made from wheat and it has sugar. Try consuming the whole form of it. And then try having a lot of fruits, exercise daily, and clean your face after exercise. All of these precautions should prevent you from having further acne, and also it will help in regulating your sebum production as well. Coming to our consultation options, we have offline and online consultation. Through online, if you're someone who is watching this video and would like to get in touch with us, you can contact us through the above given number, either through WhatsApp or through call. If you're someone who is living nearby, you can come and contact us in person in Manikonda branch or the nearest branch near you. And the online consultation, we do audio as well as video depending on the availability and the time slot. After you had a chat with us and you're okay with the medication after the investigations and all of that stuff, if you want medications, we will send it to you. If it is in India, all over India, the shipping will take 3 days. If it is in US, it will take 4 days. If it is in any country other than US, it might take 5 to 6 business days. Keep that in mind. And while you're calling, you can call through this number or through WhatsApp. And why do you want to opt for Fidicus? It is because of the highest rates of success that people have seen. The testimony, you can check our website and the testimonies in it. And also the treatment is transparent and the medicines will be delivered to you in highest quality and then within 5 to 6 business days anywhere in the world. Thank you.
Fidicus Homeopathy.